now.
We're absolutely live. Welcome everyone to another Holistic Vet Sisters. It's 6 o'clock in the UK and we're going live at 7 o'clock where Dr. Lise Hansen is and Dr. Beatrice as well at 7 o'clock where she is. So some of you may be watching it and it's even later, but welcome wherever you're watching it in the world to the Holistic Vet Sisters. So we are here to answer some questions for you. We've had a couple of them asked on the messenger of the page, and if you have any more, then do put them in the comments today and we will aim to get to those. We have a few topics that we'd like to talk to you about as well. So yeah, we'll see where we're at. Now, I hope you remember Beatrice. She's a lovely homeopathic vet who's been with us before. She's definitely one of the Holistic Vet Sisters now. You've been on enough times
Absolutely.
to be officially one of us, I think. How are you? How are you, Beatrice?
I'm fine. I'm fine. I had a busy week so far. And yeah, the weather is lovely here at the moment. So I'm seeing a lot of dogs outside. And as I'm doing osteopathy as well, I have several people calling that their dog has done this and that because here it's lovely weather and it's nice and sunny and warm and they are running around like crazy and so they hurt themselves as well.
Mm-hmm, mm-hmm.
And this is the osteopathy side of your practice.
Yeah, well, part of it. I mean, it's also the homeopathic side, but it's both.
Do you find that there is this tendency to use kind of really like throwing toys that
All
we
the
seem to
time.
use over here? Yeah, they're very popular, are they, where you are?
They are
Is
very,
it-
very popular, and they even have these prolonged things where you put the ball on and then they throw it all the time. And I mean, I don't go to parks with my current dog, but I used to go to a lot of parks. And in Munich, where I live, dogs are allowed to run free everywhere. There is no restriction. And there are some dogs that just go hunt the ball all the time for hours. I mean, that's really horrible. And it makes for a lot of problems. It keeps the vets, um, in work, but it's not good for the dogs. I
Mm.
just had that yesterday. I had a cockapoo. It's a Cocker Spaniel Poodle mix in my practice, and he was so achy in his thoracical region because they're always going with the frisbee.
Mm.
And apart from that, they also develop a sort of uh, um, uh, addiction for this kind of running and playing with the stuff. And they're really, I mean, the moment when they see their toy, they have there are there's science about that the amygdala, the part where you have your the system in your head where you feel things that you like, has the same thing is happening as if you're an alcohol addict.
Oh, really?
Yes.
Yeah. Well, that's the dopamine, isn't it?
Mm.
Yes.
Mm.
It's a little bit like what they say about us always looking at our phones, that, we want that kind of feel of dopamine again every time we
But
do it.
it's worse. I mean, I saw this video where they put in people that have not taken alcoholics, that haven't had alcohol for 30 years, and they put them in an MRI and they put a bottle of wine next to them, and the amygdala lights up like crazy after 30 years. And it's the same with dogs and toys.
It's like a border collie and a tennis ball. Same
It's
thing.
completely crazy.
Us and a bottle of wine, or an
And
alcoholic and a bottle of
it's
wine,
not
I should say,
healthy
not
for the
us.
head. Yeah, and it's not healthy for your brain. It's not healthy for your body either. So that's
Oh.
really not something you should do with your dog.
And the twists and the turns,
Yeah.
Yes. And the
when
repetitive movement.
yes,
I mean,
Mm.
and
yes.
like, you know, yeah.
Yeah, it's interesting, isn't it? I mean, like you said, it makes for lots of clients for you
Yeah.
as an osteopath. I mean, at least you're there to support them.
Yeah, but still.
A lot of dogs, the guardians might not even realize.
But I mean,
Yes.
it's such an important point. I think it's worth just repeating what Beatrice just said. Throwing games are just for almost all dogs, a bad idea.
Yeah.
And there's two reasons for it. I think one is the stress, you get this manic, addictive, crazy, you're just all the way up here, it's all going and it's hard to stop, and it's actually really stressful. That's one side of it, the mental agitation, which is not a healthy, balanced way to interact. But the other is the physical, the injuries. It's like middle-aged men playing squash. You're going to do yourself an injury because your movements are not planned, and there's no flow, there's no order to the way that you move. It's
Yeah.
just the ball changes direction, and then you do these overextensions and sudden twists and breaks, and you're going to harm yourself. And even though a dog may not walk away lame, those tiny little micro injuries that happen in the joints over time are going to lead to arthritis and all sorts of problems in the locomotor system. So it's
Yes.
just not a bad idea. I think that's thanks for making that
Yeah.
point, and forgive me for repeating it, but I
No,
just
it's
think it's
okay.
really, really good one.
Well, it turns into silent pain, I think, sometimes as well. And then that leads to escalating behaviors, which, we think, oh, there's nothing's happened recently that could have, nothing's changed. And
Yeah.
actually, something did. We've had what they're calling like a soft play park for dogs open here. And it's a little bit like one of these kids' ballpark type things that you go to and you have a coffee and the kids go off and play. And, like the concept sounds really cute and endearing. But to me, I'm like, goodness me, please don't take your dog to one of these.
Yeah.
Even if they're on their own and you've booked the area just for your dog, there could still be issues that, like we've just discussed, let alone if there's other dogs involved as well.
Yes.
And they meet each other in the ballpark area, or oh goodness, it just doesn't beg a belief, does it?
Yeah.
Mm.
And you
So
see, when you throw a ball and they don't know where it lands, I mean, they stop like like you have a car accident. And
mm,
some of them do somersaults in the end because they are so fast and they can't really, and that, I mean, that is horrible on them.
mm, mm,
And I mean, I have this conversation all the time with people, and you can see how their heart is kind of breaking when they say, oh, but it's the one thing they love more than
Yeah.
anything, and it's a daily joy. And my point about that is that you can change the game. You don't have to not play. You can go out, you can even bring the ball or the frisbee or the stick or whatever it is. Just change the game, so that
Yes.
what I used to do with my Toller was that I would show her something, and then she would be distracted, or her eye, she would be turned away, or her eyes would be covered, and then we'd hide it.
Yes.
And then she would look for it, and she would look for it. She would not give up. But the way she ran was completely different. Instead of this kind of crazy chasing something, and like Beatrice said, you do somersaults and you hurt yourself, she would be very, very systematically. It's amazing to see how she would just cover the area looking for the scent, back and forth in one direction, and where's the wind, and back and forth in the
Yeah.
other direction. But it was, she was trotting, she was in control of her movements, she was doing a job in a sensible way, and she was getting the mental stimulation as well as the physical stimulation. So you can definitely still have, the activity, and you can have the engagement, and you can have the game. Just change it a little bit so it's not that head over heels, crazy, tumbling stress, and get it down a gear and make it a more sensible
Yeah, and you can
exercise.
and you really see how addicted they are, because I had a friend, her golden retriever, she had a slip disc, so she couldn't play with her anymore. And the first 4 weeks going out with that dog were torture, because the dog would bark and she didn't
Mm.
understand that she wouldn't get the ball. And it was really, really awful for both.
But that's also kind of how you see that it's an addiction, isn't
Yeah,
it? I mean, if you throw the ball 3 times, or the frisbee, and you can't stop because
yeah,
they're like, give me more, give me more.
yeah,
It's that's just not healthy.
yeah,
that is really useful, you explaining a different way to play with the dog, though. I mean, because that's real canine enrichment, that kind of
Mm.
scenting and finding. And it's also really emotionally grounding. So they're then less likely to have as much cortisol running around their
Yeah,
system
yeah.
if they've emotionally ground and they've reached contentment instead of
yeah,
getting into that state of charge almost.
Yeah, exactly. That's a good word to use for it. The other situation where I end up having very similar conversations actually is about this, speaking of enrichment and activities for dogs, um a lot of dog carers and a lot of trainers, certainly going back a few years, have been um recommending, you spread some food, throw some treats, or throw some, it's easier if you feed kibble, I suppose, but let them search out the food from the ground, instead of feeding them in a bowl, throw it in the garden. And that's a really bad idea, in my opinion, because that's, eating from the ground. That's how lungworm is spread. It's just a bad habit. You don't want to teach a dog to eat from the ground. And again, you see people, but that's what we do every morning. That's how they sort of start their day. And again, you can change it just a little bit. Put whatever food you want to give them, put it in I have an old leather pencil case with a zip, I put stuff in there and I show it to them and I hide it, and then they find it and then they have it. So that's just another way to play the same game, but without the risks involved. So very often it's not that we have to go without, or we have to ban everything that's fun and, everything that's joyful, but it's just giving it a little twist so that you still get the joy out of it, but without the risks.
Although most people would feed a dog a raw meaty bone outside on the grass, wouldn't they? I mean, so how do they
Sure.
avoid lungworm then?
Well, you can do it on the tiles, or do it on a blanket, or and I think if you're if you're lying on the grass eating something, that's probably less risky than if you're picking up
ferreting
tiny
about.
little kibble bits from a muddy lawn or something. But but I have this argument all the time with trainers who like to smear something edible on tree trunks, and well, it's just not a good idea in terms of avoiding parasites. It seems to be asking for trouble.
So actually, one of the ladies that asked a question, she had a toller.
Yes, I noticed that. Tellers are nice.
Bias. You're biased.
Yes. Tellers
You
are
want me to
beautiful
read the
dogs.
question? The question is, do you want the question about the pregnancy, feeding during pregnancy? So we've had a wonderfully written pregnancy feeding plan here from Joan, which is terrific, and it is very well thought out. She's really asking mainly, how does she avoid eclampsia, and can she reduce the likelihood of eclampsia by considering the calcium content towards the end of the dog's pregnancy? So what do you think, Lise? Come to you first.
I think I mean, there's different points to make about that. I suppose what I really, really think is that who knows? I'm not sure. I'm not sure where Joan found the quote that she's given on. We're so full of percentages and guidelines and rules, and then we argue about them. But I suppose my hesitation is because I'm thinking, yes, but how do we really know? Has anyone done a study that looks at calcium content in raw fed dogs during pregnancy and the risk of eclampsia? My guess is not. So I think the most honest answer I can give is I don't know. And I don't know if anybody knows, but I wouldn't worry about it too much. I've been recommending raw for 30 years. I treat dogs from lots and lots of breeders. I have never seen a link between raw fed female dogs and eclampsia. But more importantly, because I'm only one person with my own experience, but I've never read a paper on it. I've never seen it flagged as an issue. So I'm not sure the risk is worth lying awake at night about, really. That would be my point. What did the two of you think? What do you think, Beatrice?
I agree. Totally.
You wouldn't worry about feeding
no,
no,
not at all. I mean, I wouldn't maybe feed as much bone in the end for other reasons, like, you want the stool not to be that hard and stuff like that, but not because of eclampsia.
No.
I think I mean, the stool thing is perfect. You would reduce it for that, really, if you were going to. But I think possibly the idea of it being an issue would come from the processed food industry, and balances not being as they should be, or in the natural formation. I mean, what sort of happens with carnivorous beings that also walk the planet? You know, I mean, otters, and do you see them sort of reducing calcium when they're about to whelp, and even wolves? And I don't know that they do. You know, I mean, okay, could argue that maybe instinctively they do, and we just haven't noticed the behavior, I suppose. But it's not something that we really tend to think about. I would say it's come from the processed pet food industry, as has a lot of the things that we really concern ourselves about with the way we fresh feed, like cats and taurine. You know, it's I think it's totally over worried about, because the processed pet food industry have gone to lengths to make it clear that they offer enough in their pet food. So we then feel that there should be more of a consideration of that amino acid against others. But actually, when you're feeding a fresh food diet, you're far less likely to have an issue as you would if you're feeding processed food. So already it's less of an issue because of what you've chosen to feed. So yeah, there's so much like that, I think, where we worry a lot because of what's happened in the pet food industry. And I think it's not to say that those things aren't worth considering, but it's just understanding of where that's come from, questioning it, going to look at where that's come from. Why do we believe these things? And that alone sometimes can make you feel better, can't it? When you realize actually it's probably not worth us thinking about it as deeply.
Mhm.
It's part of a bigger picture when you look at it like that, isn't it? That we're so conditioned that we have to feed these products. We have to, you know, we're alienated from sort of simple caregiving, that when we then take charge and feed real food, there's this fear of, it's almost like I'm a rebel, you know, I'm doing this in a different way. I dare give my dog food. There's so many ways I can go wrong. And actually, there are very few ways you can go wrong. I wouldn't really be concerned about it at all.
And I mean, dogs came to live with us because they wanted the real food. I mean,
Yeah.
that's how it happened, you know.
Well, they wanted it cooked, maybe.
Maybe, but
Nice.
you know,
Yeah.
yeah,
Yeah.
but depending on where the dog is from, I mean, that's a different kind of matter, that when you have a dog that comes from the northern hemisphere, that they want different food than maybe a dog that has had for generations cooked food. But that's a different thing now.
Epigenetics come into it. Yeah. Yeah.
Yeah, a lot actually. Yeah. So because I know I'm not talking about puppies now, but in my practice I see that huskies and such, they often don't tolerate carbohydrates at all because they're just not made for them where they come from.
Completely.
There are no carbohydrates for them, you know?
Well, in the one study that seems to be used by every pet food brand that has any kind of like grains or starches in it, they seem to produce this one study about the AME2
Yeah.
gene, gene that has been shown to be expressed more in dogs than it is in wolves. And apparently then that lends themselves to having the great amount of starches that you find in products
Well,
these days, which is I don't think it does justify the volume of them at all. But even with that, there's the caveat that there are dogs that didn't show the gene expression. So they didn't have the mutated gene. So you've got your huskies is one of them, you know,
yeah.
which makes total sense. Westies.
Yeah.
Westies didn't show the gene mutation. And, you know, it worries me with that brands utilize what they call the science to then show that it possibly is okay for dogs to eat their food. However, they don't say, but by the way, Westie owners, Husky owners, you might not want to take notice of that, you know? So
Hmm.
for me, at what point do they put the Westies and the Huskies first? You know, those dogs are notorious for skin issues. So
Yes.
you know, it's we do have to we I think they have to go beyond. If they've got that scientific paper and they really feel the need to share it, at least then think about the dog at the end and care enough
Hmm.
to share with people the breeds that don't have the mutations. Also Chinese crested, they didn't either.
Hmm.
remember rightly. So another breed, not so many of them as there are Westies, but even so, you know, people love their Chinese crested. They knit them jumpers, for heaven's sake. So,
Yeah,
they definitely don't want them to be unhealthy.
I
of
had a
course
couple
not.
of those in the clinic this week. They were
Yeah,
lovely, lovely dogs. Yeah,
Oh, did
they're
you?
fun. They're fun.
Yeah,
It always strikes me how dogs are so, I mean, there are small people and big people, and there are small horses and big horses, but I mean, dogs, the scale within one species like that.
incredible, isn't it?
Yeah, I had Chinese crested, and then the next patient is a Mastiff that's 120 kilos, and you're just like, how can this be the same animal? I think it's
Yeah.
just, they're so fascinating. And yet they are the same animal, and they have largely the same needs.
yes. So yeah. Well, we do have a question about puppy vax. Another one.
Yes,
Seems
I'm
to be
just
a weekly
looking at that.
occurrence. Do you want me to read it out, or do you want to?
I've got it in front of me. If you,
I don't
shall
need.
I?
Go
Sorry,
on,
I
you
think
do.
it's because I'm looking at this and I can't see you. I speak over you. I'm sorry. I've got it right in front of me. It says, I also have a second question. I won't vaccinate the pups until they are 12 weeks or older, once their maternal immunity starts to wane. I have always done the puppy course of vaccinations and nothing more, because even if the antibodies drop, there will still be memory cells left to recognize the virus and start antibody production. And then there's a follow-up question on nosodes. What are your thoughts on vaccinating pups versus not vaccinating and using nosodes? Can I get nosodes to use instead of vaccines in the UK? And I think, first of all, these are such important topics that I'd really like to answer them, even though we have covered all of them before. If anyone wants to go back and listen to previous episodes, this has come up several times already. We're just in the process of making the all the past episodes more accessible and easier to find the information that you're looking for. So watch this space. But to answer the question, if I can go first, Beatrice, and then
Yeah,
you can
you
contradict
do.
me if you can think of it. If you, I'd love you to. But my point would be, the point that we keep repeating is that it's absolutely crucial to understand the concept that the reason we give puppies lots of vaccines is because they only need one, but we don't know when to give it. And the reason we don't know when to give it in the case of each individual pup is that the mother's antibodies that they get through the colostrum during the first few days of life wane at different rates, and it's a different time for each pup that they can receive a vaccine without the mother's antibodies blocking the vaccine. And the main point here is we don't know when. So 12 weeks, sure, if you only have one vaccine available and that's when you're going to give it, 12 weeks is probably not a bad estimate, but there are some puppies who will not be responding at 12 weeks, and there are some puppies who will be unprotected from they are about 7.5. So the idea, I heard someone say this recently, that a vet say that, which I was sort of a bit frustrated to hear, that there's no point in vaccinating any pup till they're 12 weeks because the maternal antibodies get in the way. And we just can't say that. That's not a general truth. It's true for some puppies, it's not true for others, and we can't tell the difference unless we do a blood test and test their antibodies. So we know that the mother's protection fades away at some point between 8 weeks and 16, maybe just after 16 weeks of age. So some puppies are ready to be vaccinated at 8 weeks. I seem to remember it's about half of the puppies that are ready to be vaccinated about 8 weeks. Some of them are not, and then they'll be ready at 12. Most of them will be ready at 12 weeks, but some of them will not be ready till they're about 16 weeks. So the point is, we don't know when each pup can be vaccinated. We can find out by taking blood tests if it's a puppy that's easy to blood sample and it's not too stressful. But otherwise, sure, you can say, well, I'm prepared to live with the risk that these pups are maybe unprotected for some weeks and just vaccinate them at 12 weeks. The absolutely most important thing, in my view, is that all puppies have a titer test when they're about 5 or 6 months old, because then you test that the puppy vaccines have worked. I would absolutely not be happy with an approach that said, I'm going to vaccinate all puppies at 12 weeks and let that be it, because some of them will not have responded to vaccination and will be unprotected and could fall dangerously ill at a later point. So whether you give them 1 or 2 or 3 or 4 puppy vaccines, that's an individual risk assessment, but please do a blood test at 5 or 6 months to test that they have responded to the vaccines. No-sodes, I'm a homeopath. Beatrice is a homeopath. And I don't know if you're going to agree with me, but I would not be happy to say use no-sodes instead of vaccines. That's safe. I think that's dangerous advice. Good. Beatrice, what do you think? How would you?
I agree. I could not agree more. I'm not, no, I mean, I use no-sodes, but for different things, but certainly not to use them instead of vaccines. But what I would really like to know is how many dogs don't have a titer at 5 months? How many are there? Is there a statistic? Is there any, do we have data about that? If they are vaccinated, you know?
I
How
bet
many?
you there's more at a year, because generally people will kind of leave it until they're asked again by the vets and then be like, okay, should I do this? So then that comes the time that they do the titer. So probably
So,
more likely a year-ish.
yeah, but how many are there? Because
What do you mean that are vaccinated and that are still negative at 5 months?
yeah,
I see.
or a year. I mean that they don't have a titer. How
I
many are
I
there?
don't see many talked
Because
about
in all the time
groups.
I've done titer testing, I've had exactly one dog
I
who
mean,
didn't have a titer.
yeah, no, I mean, absolutely. Most of them will respond if you vaccinate them
Yeah,
at 16 weeks. There was one study that, I mean, there are studies on it. If it's more than a rhetorical question, there was one study back in the time when we only vaccinated at 8 and 12 weeks. And that found about 25% of dogs not covered. So, but I mean, these days when we vaccinate again, at least at 16 weeks, if not a fourth time, then I think that number has gone down to a very, very, very small fraction
yeah,
indeed. Absolutely. The other important point in the question is about ignoring the titer almost because there is cellular immunity. We've talked about that several times.
yeah,
We talked about it last week as well. That is a very common myth. Largely speaking, the cellular immunity and the bloodborne immunity come together. And if you don't have antibodies, you have no way of knowing if you have cellular immunity enough
exactly.
or not. I had the pleasure of asking Professor Day, who was the chairman of the World Small Animal Veterinary Association Vaccine Guideline Group from the outset, and probably the vet in the world who knew the most about dogs and their immune systems. And he says we have to assume if there are no antibodies, there is no cellular immunity. So it's absolutely unsafe to say, I'm not going to titer or I'm going to ignore negative titer and assume there is cellular immunity. There is just no evidence that you can assume that. And there's quite a few experts very clearly saying that you cannot assume that. But like Beatrice said, the titers are generally positive. So it's not an issue. False negative titers have to be rare because false titers are extremely rare.
Yeah.
Definitely. So what do you tell people, Beatrice, if someone calls you and say, I have just bought a beautiful 8-week-old toller that was unvaccinated, what should I do now? I wish it was me.
Well, in my practice, if someone has a new puppy, I usually don't have a first appointment to do vaccination. They just come in and get to know the practice and get to know the nice vet that only has treats for them. So they have a positive experience. But usually if they have them with 8 weeks, they just had their first puppy vaccination. In Germany, it's usually like that. Because if it's a respectable breeder, he won't have papers or anything without vaccination.
Yeah, most puppies are vaccinated just
Yeah,
before they leave the
they
breeder,
get
aren't they?
their microchip and they get the vaccine and they get their passport and then they come to me. So at first it's not an issue. So we just talk about deworming maybe and other things and what they can do with their puppy or not, because a lot of people are afraid they will overdo something with their puppy, that there's still that myth you only should move your puppy 5 minutes for every week they are old or whatever. And it's interesting what myths are everywhere. And it's more about what do I feed, what can I give them, is it dangerous to feed them raw when they are that small, and stuff like that. And then we usually vaccinate them at maybe 12, 13, 14 weeks. It depends.
Mm.
But I don't make an issue if they are a little late, because what we learned from immunologists in Germany is that it's not really an issue if I do the second vaccination at 12 or 13 or 14 weeks. It's just to do it at some point. And then I tell them they should come at some point, maybe after a year, and do a titer test. It depends. It depends on the puppy guardian, and then we'll see. But that's what happens, you know. We talk. Usually the first appointment is we just talk and play with the puppy.
Mm. But that's also, I mean, all good answers begin with "it depends," don't they?
Yes.
Because it's up to the individual situation. What's the lifestyle? What's the health?
Yeah.
Where do we live? What's the exposure? There's so many individual factors to consider.
I mean, if I
Um,
have a puppy that lives in a city and is usually walking around in the neighborhood, it's not the same as if I have a puppy that lives on a farm. It's
what
entire.
what's the advice that you give about the level of activity for puppies?
It depends on the breed. First and foremost on the breed. I mean, I don't tell them to go into the mountains and climb 3 hours with the puppy, and unless they have a rucksack or something where they can put the puppy in. Um, if it's not a Landseer or a Mastiff, then it's kind of difficult.
Even then, yeah.
But I don't. I tell them not to make an issue if they are around a half an hour more. I mean, that won't kill the puppy. And I tell them not to go too far when they walk them, so their puppy won't get tired and can't make the way back. So make smaller rounds, meet other puppies if you can, and stuff like that.
Mm.
Take them to the bus or to into the city so they get to know things. I mean, the problem isn't that you do for most. I don't know how it is with you, but most people, it's not the problem that they do too much as physical activity. They sometimes do too much at all. I mean, they do just too much with their
Yeah.
puppies.
Yes. Yeah, they don't appreciate just how much sleep they need.
And just, not to overdo the impressions and everything. Just do it slowly. Let them discover life instead of forcing it on them, you know? And that sometimes you get a puppy that is completely, overwhelmed with everything. And then you talk to the people and then you see what they do. Oh, we did this morning. It's like with the kids that have a full schedule at the age of 7. It's like that because they are afraid they will miss something. And make it slowly, make it, but
Yeah.
yeah.
Great. Mm.
Yeah, and look at your pup, rather than plan it all
Yes.
based on books or webinars or,
Yeah.
just actually look at your pup. How do they respond?
Yes. Are they happy? Do
Mm.
they when you come home and you have a day with them and they eat their food and then throw up, you've probably done too much. Like, just look at that. And so that's what we do. So the first it's the get to know appointment.
Yeah.
It's the nice appointments. It's really, I mean, they are super because we just sit around and the puppy plays around and usually pees in the practice and you know what they do.
When would you, in an ideal world, when would you ideally see an osteopath for the first time? I mean, do you find osteopathic corrections are relevant at 8 weeks, or would you like to do them earlier? Or
Well, the breeders I have, they bring me their puppies at maybe 6 weeks the first time, and they leave the breeder after they had their first osteopathic appointment, which sometimes is treatment, sometimes not. Sometimes it's just to tell them where the weakness of the puppy maybe could be, and to tell the new owners, guardians, what to look for. And sometimes I tell the new guardians to see an osteopath maybe in 3 months and have another look at it. And if the puppy comes to me at 8 weeks And we are in the get to know. I mean, osteopathy for a puppy is feel well time. They love it. So it's part of the first appointment, which means that they come on the table, they get some treats, and then I touch them. And if you are an osteopath or have been an osteopath for a while, you can't really touch an animal and not feel. So it's osteopathy is sort of included in the first appointment. And the most important thing is to see how are the knees? Are they okay or not? Because that's really a problem in puppies, in a lot of breeds, that they have weak knees, really, really bad knees. And then it's important to tell the guardians what not to do with the puppy, not to let them jump into the car, not to let them jump out of the car, not to do ball. I mean, we had this before, not to do this and that, not to let them climb stairs, and more importantly, not to let them go down the stairs and stuff like that. And usually and give them some pointers what they can do, like a little, like physical therapy in the tiniest way at home, and then this straightens out easily and very quickly. But that's what I do. I mean, that's sort of my pet peeve, that I look at the knees, how they feel, and if they are okay, if they sit well. A lot of breeds have problems, just because the way they are made, like all the round breeds, they usually have really bad knees, and if you are careful, you can really live well with them, but you just have to know.
Which is so interesting because we don't often realize the things that can be found so early on in the dog's life, and we do all the things we think are correct and feeding correctly. And yeah, and actually there's been something since they were born.
Yes. And I mean, you can never forget that at that point, I mean, at 8 weeks, nothing is fixed. Even if your puppy could have, for example, subluxated something, and you do the right, yeah, because it could be subluxated everywhere. But if you have it fast enough and early enough, and you do the right therapy, it can grow together very well, and you never have to do surgery later. I mean, that's really fascinating,
And for many puppy owners or dog owners that wouldn't have that almost privileged, wonderful initial consultation with someone who's an osteopath, I mean, what sort of things could develop, and how quickly would you see these things in the older dogs as they got older?
What do you mean?
I mean, how quickly, if they haven't seen a vet like you, could a puppy develop issues? I mean, are we talking 6 months, or it wouldn't show till they're sort of 3 or
It
4?
depends. We are at depends again.
Yeah, all good answers. I told
Depending
you.
on how they, I
because
suppose,
some are earlier, some are later.
they're looked
And
after.
yeah, and I had this German pinscher who was only 5 months old and is already doing this classical, when they jump with one hind leg and you see the knee isn't okay, and they have a luxated patella, and it's already at 5 months, because they didn't know that the dog had that problem from the get-go, And later they found out that out of the litter, 5 of the 6 puppies had all the same problems. And the funny part is 2 of them saw an osteopath when they were very small. And they still have weak knees, but they don't jump. So you see the difference it makes,
One of
And
the APNC associates is also a veterinary physio, and she talks quite often about the fact that, especially dogs that eat processed food, they'll have this puppy food, and then all of a sudden they get to what's deemed an adult, and they're switched onto an adult type of food, and the drop in the protein is quite substantial,
oh yeah,
which could really be contributing then to changes in the way their ligaments are, the way their fascia is, and just the amount of amino acids that are available to keep building that which
yes.
they need. Yeah. So it's something that I hadn't thought of it until she mentioned it, but it's very true. I mean, obviously, if you're fresh feeding, that doesn't become so much of an issue.
No.
Another reason to fresh feed.
Yes,
Yeah.
Yeah.
of course.
And it is a good point that I mean, it's so lovely meeting puppies. I don't do that so much anymore because I generally see very chronically ill animals later in life once things have gone wrong. But you know, to have a conversation with someone before everything goes wrong, so that you're able to just prepare for a healthier life and to talk about, you know, tell everybody, don't neuter your dog. We don't do that anymore. Don't give them ultra processed foods, you know, vaccinate knowingly, you know, vaccinate for sure, but know what vaccines to give and when to give them and when to titer test, and using parasite treatments with care, and to just have those conversations early on. You could just put someone on a completely different path.
Oh yeah.
That's
And
really
and
interesting.
give maybe the most important thing that you can tell them is to relax. Really, because I think that's so, so, so important to relax. Because nature is so good at healing itself and doing things the right way if you just relax a bit and don't think you have to intervene all the time. I mean, a puppy having diarrhea for a day is not an emergency, unless, of course, other things happen. But it happens. It just happens. And then you give maybe moral soup or whatever, and then it's okay again, you know. So
Yeah.
so that's what I try to tell them. Just relax.
Yeah.
And you could just feel us all relaxing when you said it, you know. Yes.
Have
Just
everybody
relax.
hypnotized by
Yeah.
the vet sisters. So you were talking, Beatrice, that you also this week have seen, or just of late, have seen more and more dogs with cancer diagnoses.
Yes.
And what do you think's happening then? Why is this, do you think?
I have no idea. It's just something that's, I mean, I used to have maybe a cancer patient once a month or so. And now I've had maybe 6 the last 2 weeks. And that is kind of an explosion for me. I have no idea where it comes from. Because that would be theorizing in the out of the blue. I don't know. It's just something I've noticed. And I don't know what happens. I mean, I've always had dogs with mammary tumors, but that's kind of happening all the time. And I'm not really excited by it because most mammary tumors are not a problem, but at least from my experience. But I've had a big dog with an insulinoma, and I don't see them really often. So this is really rare. And other kinds of cancers, which is lung cancer and the cancer that the tumors that sit on the basis of the heart. I've had 3 this month, which is kind of scary because it's not something I see all the time. And the more scary thing is that you can feel them osteopathically, and that's even scarier. But yeah, I can't explain it. I don't know how it's with you. If you had
You have to elaborate on that. You can feel them osteopathically.
yeah, well, there is it's hard to explain, but you have this. The first dog I had with a tumor at the basis of the heart, it's been years and years back, and I put my hand on the back, and I had the feeling as if my hand was falling into the thorax, you know, as if it was just falling in. Was drawn in. I couldn't explain it. Now I know if I have this feeling, mostly I don't like it because I know what's going to be found in the ultrasound and so on. But it's a very weird feeling above the heart, and you are on the vertebrae, and you have this feeling as if your hand is drawn inside. It's hard to explain if you're not an osteopath, but it's something other osteopaths have felt, I'm sure.
There's
And
something serious, heavy, energetically going on there.
strange, you know. And anyway,
What sort of age were these dogs that you've seen recently?
some of them older, of course, but one is only 8, the other is only 6 years old. So early, one is a German Shepherd with a huge osteosarcoma on its scapula, which is only not even 5. So
So what sort of things are you suggesting that the guardians look at then to support these dogs?
well, the German Shepherd was too old, too far advanced. With I only saw the tumor when it was like 2 fists big. So it's really too late to try anything to cure it. I'm very, very cautious using that word in connection with cancer. I mean, I have the good cases too, but with the insulinoma case, which is really a rare one, we do several things with the dog, but there are medical stuff you have to do to control the insulin and everything like that, and that I treat it homeopathically, and then we will see how we go. I've had insulinoma patients before that went well, and one of them didn't even die of the insulinoma, so we will see.
So it's homeopathy for cancer. I mean, it isn't normally your first thought, I guess, if you've got a dog with cancer. I think we sort of go down the route of diet, medicinal mushrooms, CBD, that sort of thing.
Well, that depends who you are. You're
Well,
two
I think
homeopaths
you
here.
guys would, but as a guardian, I think it's possibly not something that they're immediately reaching for.
Yeah.
So
Probably
tell
not.
us
Yeah.
about homeopathy for cancer and
Well, it depends. It
again, it
depends.
depends on the
Yeah,
dog.
because it really depends what case you have, and what is possible is if the guardian is going with you in that kind of treatment. I've had a dog with an osteosarcoma. I only used homeopathy with, and the sarcoma was the body sort of encapsulated the osteosarcoma, and it's fine. It's been fine for the past 8 years. So, and that was just homeopathy, you know. And then there are cases where I use what I often use is Artemisia annua. It's a plant, and it's known to use in cancer, also in stuff like leishmaniasis and other vector-driven problems. Artemisia is very popular in Africa for malaria.
Oh,
And
Artemisia. Is that
Artemisia
it?
annua is the Latin name.
As a herbal
It's a
remedy.
herbal, yeah,
Yeah.
it's a herbal
Rather than
remedy.
because it's also a
Yeah,
homeopathic remedy,
I
but you're
know,
using it
I
as
know.
a herb.
Yeah.
Yeah.
In that
Yeah.
case, I use it as a herb, and that is a good thing to look for, and to find someone who is knowledgeable about it. Often medicinal mushrooms are a supporting therapy, and even in progressed cancer cases, you can use medicinal mushrooms, but you can also use classical homeopathy, which can be fascinating if you see what happens. And I had a Ridgeback who was diagnosed with liver cell and gallbladder carcinoma. He had surgery 3 years ago. He's doing fine on homeopathy and some other stuff. So that can work well. I just because I thought of him because I had a email from his guardian, and she wrote that they are in the 3rd year post surgery, and she's so happy he's still there, and she's hopes he's going to celebrate his 11th birthday next year. So that is lovely. I mean, that's how that's when I get something like that. I think that's why we do our jobs, isn't it? I mean, that's really why we do it.
So I've just looked up Artemisia. Wormwood is a type of Artemisia.
There are different
Mugwort
artemisias,
is as well.
and then there is the 1 year artemisia called Artemisia annua.
Annua. Ooh,
Annua. It's
interesting.
Annua.
I wonder what Vicky, our herbalist sister, will think of this.
No, yeah. We'll have to ask Vicky
Mention
when
it.
she's back.
It,
Yeah.
And
it
it's
seems
very,
like
yeah,
the whole Artemisia family, hopefully I'm saying,
yes, there's a whole family.
are useful for us and our dogs.
And there has been a Nobel Prize in 2015, I think, about the artemisinin, the one of the stuff that's in the Artemisia family, because as I said, in Africa, Artemisia is used as a remedy for malaria. So this was the idea. The problem is that if you extract one thing, the development of resistance is very high. If you use the plant, you don't have that.
Yes, you don't get the
Yeah,
side effects either, really.
yes, yes,
Yeah, yeah. So it's the whole plant
yes,
is really how it should be
yeah,
used. Just that compound. Yes,
yes.
true. So true.
So you use that. So that is something I regularly use in cancer patient actually.
Yeah,
You
that's
just have to make you just have to make sure because Artemisia needs a high iron value in the blood. So you have to feed iron or blood. You could use blood
yeah,
because it needs that to destroy cancer cells
I see. So it works with iron.
with
Uh,
iron. Yeah,
oh, that's
yeah,
interesting, isn't it then? So do you think that the dog needs to have some decent vitamin C levels as well, maybe?
yeah. That and vitamin D and stuff like that. I would look for that too. But that's the general stuff. If I have a chronic patient to look for stuff like that, and not just in cancer patients, you know.
I mean, that's a whole other rabbit hole to go down,
Oh yes,
as in which herbs work better or how are they are relating to minerals or vitamins in the body,
yeah,
because it could be that you're using a particular herb and why is this not helping my dog? Everybody else says it does, and actually because your dog does not have the mineral that usually it works with, that herb. That's
that too. And I think another problem is that a lot of guardians use herbal stuff for their dogs and use too much.
overdosing
Oh,
almost.
yeah, and they use all we have stuff like 50 garden herbs or 50 healthy herbs. And I have dogs that just vomit because they get something like that and can't digest it. You know,
Hmm.
that's
Yeah,
the other side of herbal treatment. It's not, you
yeah,
know,
I think it's important to actually be working with a herbalist vet,
yeah,
really.
Yeah,
Yeah.
absolutely. And there is that widespread assumption sometimes that this is natural or this is good. So
yes,
we just give it because it must be good because it's natural.
yes,
And that's just a bad idea, really. You need to know what you're doing and you need to only give something if there's a reason for it and a point behind it. And
Yeah, I think that's the same with supplements in general.
exactly.
Completely overused. We've almost forgotten how powerful nutrients actually are.
oh, yes,
Deficiencies, if you correct a deficiency, you don't often need all these random supplements you were using to control symptoms,
Yeah.
natural or otherwise.
yeah,
Yeah,
I think that's really important because we have this, it's fear driven. I think we can buy health. We think if we look for some really, really good, really, really expensive supplements, maybe they have to be expensive and we maybe have to import them from really far away, and then they will definitely make our animal live forever.
oh,
And then it is that fear that drives it rather than just
Mind you, I've been there. It feels awful when you can't help your dog, and me being me, it feels even worse because I beat myself up that I really should be able to. So,
But
yeah,
sometimes these are even healthy animals. And it's just
yes,
like Beatrice said,
true.
sometimes you just need to relax and trust
Yes.
nature and try not to get in the way of nature and not fill all this, keep filling all these things because you think they're good, when actually maybe we should just get out of the way and try to keep things simple and relax. I think that's a lovely piece of advice.
So Michelle's asking about tissue salts. How do tissue salts, she hasn't asked this, but I am. How do tissue salts differentiate from homeopathy, and what about using them in cancer or
I
for
don't use them in cancer.
No, I mean, they are homeopathic remedies, the tissue salts. They're just a particular range of homeopathic remedies made from minerals. Um, I've not used them in cancer, but I think the whole point I don't think I have, but I think the whole point in homeopathic treatment and in truly holistic treatment is that you need to find what each individual needs.
Yes.
So it will rarely be this is for cancer or this is for, let alone that type of cancer. It has to be for the individual in that situation at that time. And then probably almost anything could be relevant for someone in that situation.
This is why you need to have as much information as possible that
And you
you,
also need to know when is it, when as
yeah,
a guardian, what can I do myself and when do I really need to I have very often people contact me. I had this conversation just before we went live with someone who says, my dog has had allergies all her life. I've tried everything. People say that so often, I've tried everything. And when I look at what they've done, I feel like, but you've not done anything that you would expect to actually work in this situation. You've just Googled a few things and asked Facebook and bought a few supplements or changed the diet around a bit, but you haven't done anything that would actually likely treat this condition. But sometimes you need to see.
Like those, Lise, those tried everythings. There's usually tons you can do. Yeah.
Exactly. You look at it and you think, well, we haven't really started here yet.
Yep.
But yeah, need to seek help when you need it, I think is also a good point.
Yeah.
Okay, can I just mention also while we're talking about cancer that at 7:15 we will be going live on the Expo page, Natural Dog Expo, with David from Hemp Heroes. He's going to be talking about his CBD and his experiences with CBD because dosages aren't always understood, I don't think. Where to get good quality products isn't always understood in terms of CBD. And just, are we allowed to give it? The VMD have sort of cracked down on this somewhat. So he's going to talk to us about this and are we allowed to be retailing it and what's the situation there? Are we allowed to be giving it? What, all that sort of thing. So he's going to, it should be really interesting.
Yep.
So just say that again. Then it's the Facebook page is
Yeah.
called Natural Dog Expo.
Natural Dog Expo.
Yeah.
Which you will, I will, after this, I can put a link under. So yes, come on over to us because, we've nearly finished here. And
Yes.
then,
See, the time has flown by.
I know. That's how quickly an hour goes when you're in good company. But can I just use the last 2 minutes to talk about the Natural Dog Expo? Because clearly we want everybody to come. The Natural Dog Expo is the dog event around in Europe, I would say. I've not been to anything that comes close, and Caroline has created it. Caroline has made it happen. And it's in Birmingham or near Solihull is it's a
it's near the NEC. It's the next junction down the M42 from the NEC. So if you fly over, it's very easy to find. And Dr. Lise, you'll be talking.
I'll be talking. Regis Schultz will be talking. There'll be lots of good talks, and I would really, want everyone to come. It's going to be amazing. It's the last weekend in April.
It's the 25th and 26th of April. I don't know if that's the right way round. It's the wrong way round as I look at this.
No, it's fine.
Hopefully the right way round. Yeah. So this will be the fourth one of the Natural Dog Expo. They're just really good fun as well. Great networking, meet like-hearted people there who, believe what you believe or has been through what you've been through. My aim is that everybody really enjoys it.
And it is really a place where you feel welcome, even if you show up on your own and you don't know a soul and there's 400 people there. It's like an instant community because you share something that's so important and so fundamental. It occurred to me, I have a quick question for Caroline in the last 10 seconds. It occurred to me about the Natural Dog Expo. Do you have any idea how many of the people that come are, because I thought a lot of the people I spoke to there are either they have a shop that sells dog food, or they're groomers, or they're vet nurses, or they're trainers, or people who really they're Do you think that's the majority, or there's also lots of people who just show up because they have a dog and they love dogs and they're interested in dog health, but there is a lot of
There is a lot of industry professionals. I think that's because those are the people that are really into dogs. So
Yeah.
those are the people that are starting to question the mainstream narrative in terms of dog care more. And yes, retailers. Lots of my canine nutrition students go, of course, because it started out as their annual conference and very, very quickly grew into everybody was welcome. And, you know, like you said, it is the only one in Europe at the moment.
Wow.
That's a good point. I hadn't thought of that. I'm calling it the UK's.
Yeah, no,
Well,
I think
but
we should all come from everywhere. Birmingham is an international airport. It's only a couple of hours away from London, if that's where you're flying to. But you know, whether you just love dogs or whether it's your profession or you want it to be your profession, it's really a place to go and have an instant tribe.
It's a whole weekend this time as well. So there's loads of time to meet people, go for a coffee after or before or something, you know. Yeah.
sounds like fun.
Yeah.
Yeah.
You should come too. You must come too.
I can't because
we've gone.
at the same
You've gone
weekend
over.
I'm doing a course with Paul Huskew here in Germany.
Oh, that's the other thing. That's on my list. That's on my bucket list. I want to join that
So
Paul
much
Huskew thing. I really do.
So, and we have
I
4 days with him at the same time. So that's,
Oh,
yeah.
gosh, there's so many nice things going on in the world.
Uh-huh.
We are over
might
time.
move it, I think, another year back to the first weekend in May because it does seem to clash with so much. Anyway, yes, sorry.
We are out of
We'll
time,
be back
but
next week.
but Caroline will be back in 15 minutes on the
Yeah.
Natural Dog Expo page.
Yeah.
Good.
Thank you, Beatrice. If you just we're gonna put some other dates, put you down for some more dates in the new year because we really want you back.
You can do that.
We will.
Okay.
You make it sound like just put me down and let me know. Excellent.
Well, it depends on the day.
Yeah, it depends. That's a way to end.
We should do it, you know, on the Holistic Vet Sisters. Our motto is it depends.
It depends. That really is the best answer to any question.
But
Thank you very much for joining us. Bye.